Hi everyone, I'm Dr. Terri Alani. Welcome to my channel on YouTube. I really appreciate all of the subscribers and also all of the requests. And today we're going to talk about veneers. We're going to actually show you how we place veneers on. This is our patient. Hello.
Hello.
So we ended up, we're doing veneers on this patient for a different reason, mainly for function. I'm going to go ahead and show you his picture. And this is the before picture, so let's go to the screen. This is the patient before, and as you can see, he's got, his teeth are chipped on the edges. The two centrals are chipped, and his lateral is chipped. And so what we're doing is we're taking these teeth and we're going to veneer them. And we're going to add some length onto this one, so when he goes into a side bite, these teeth don't hit the lowers. We're not touching this one. So it's going to be 1, 2, 3, 4. Okay. Okay, so we're going to go ahead and put the 4 veneers in on the top, and we're going to show you how it's done. So we're going to zoom into the patient. And as you can see, we didn't prep a whole lot. So this is his natural teeth right here. We're going to prep. We've already prepped. This is after preparation. There's 1, 2, 3, 4. And we're going to go ahead and place these 4 in, and we're going to show you how they blend in with these. So let's go ahead and get right to it. So let's go ahead and start. We're going to prepare the teeth. What we first do is we etch the teeth, and this is what's going to allow the veneer to adhere. And I need a plastic strip, 1 plastic strip. So this stays on just for a few. It's pink, my favorite color. Actually, pink is not my favorite color. I don't really like pink. I like green and purple. Okay, so we're gonna let this sit, and now we're gonna rinse it off. Let me have the plastic strip, please. Okay, let's go ahead and rinse this off. I'm gonna place this in. Are you okay? And none of this hurt. This patient's not numb. Okay, well, let's go ahead and do the other. So then we coat it with 2 other solutions quickly. And this also prepares the tooth. What we're doing is we're priming the tooth. I need a little bit more step 1, please. We're priming the tooth so the veneer actually bonds properly, because that's what the most important thing is, you get good bond strength. Everybody thinks that we just snap these on, but that's snap-on smile. Veneers it's actually a procedure. So I'm going to go ahead and let that sit for a few seconds. And then I'm just going to air dry it. Are we okay, patient? Let's go ahead and suction down there. And then I'm going to go ahead and apply the last coat. Now this coat desensitizes the tooth as well. And this is very easy. And this just doesn't take long to cement veneers in. The importance is to make sure that you've got the teeth prepped properly and you have a great lab. We use a boutique lab down the street. Very important. These are not shipped off. So we have a lot of control with our lab to make sure the end product is actually perfect. Let's get a light, please, and let's go ahead and zap these. I call it zapping, but we use a light. And the light is a blue wavelength, and it actually sets the liquid. So it sets the liquid to prime it for the veneer to be seated. And then our next step, we will actually put the cement. Now there's many different colors of cements to use, but we're going to use one that is as closely matched to his existing teeth as possible, and you'll see how well it matches. And we'll place that on the inside of the veneer, and we'll place the veneer on the teeth, and then we'll set it again. So just bear with us with this part. Okay, so now we're going to mix the cement. The cement is here, and we're going to go ahead and mix it. So you can see we have 2 parts to the cement. So let's go ahead and mix the cement. And she's going to load the veneer. We use a special little vacuum to apply the veneer with because they're so tiny, and with gloves it makes it very, very difficult. All right, the assistant's going to place it on. Okay, so we place the veneer on the tooth. And as you can see, it fits just perfectly. Make sure that everything is seated from the inside. And then we'll go to the next one. So we're going to seat the next one. And again, we just kind of place them in place. This one is not on here quite right. There we go. Turn toward me, please. Perfect. And you just want to maneuver them because you know exactly how they're supposed to fit. And we'll take a brush and just take off the excess. Okay, let's go to the next one. And you can see how everything's taking shape. Perfect. So we've got one more. And you can see the color is just perfect. And you can also notice at the gum line how well they fit. They look like the teeth grew there. This patient's going to be incredibly happy. We got one last one. You got it? One last one. And there we go. And here they are. They're absolutely gorgeous. Now I'll step away. I'll look at them to make sure everything is correct before we finalize with the light. Turn to the left. And as you can see, these are before we finally put the final touches to it. We clean off the excess. I'll have my assistant and myself take a look. Let's go ahead and take a look. Make sure they're exactly where they need to be. And then we will take our light and we will just do a little preliminary setting of the material as we take away the excess. And the patient's fine. You're still breathing, right? And he's going to laugh. Okay. So these are perfect. Okay. Turn toward me. Go ahead and let's just tack it down. So she's going to tack it down. Before we end up finalizing it, we want to make sure everything is just perfect. This patient's going to be very happy. And let's do this one and this one. And then the back one. And I'm holding them down. I'm applying pressure. Okay. These are gorgeous. All right, let's go ahead and take out the excess cement with a scaler. So we'll just take the excess cement off. So now that we've cleaned up, we're going to go ahead and we're finishing zapping it with the light. We're not going to show you everything because it gets a little bit redundant, but we finished setting it with the light, and then we'll go in and we'll adjust his bite, and basically the process is finished. Now, the cement does take, it's set totally now, but still final cure, we just tell the patients not to bite into anything really hard for like the next maybe few hours. But other than that, it's all a done deal. 2 visits. It's good. Okay, so let's get a close-up. So these are the after. And remember, we only did these 4 teeth, and you can see how well they blend in. So we're going to go ahead and sign off, but this is how easy it is to seat veneers if they're done properly and you have a great lab to work with. Thanks for subscribing to the channel. I'm Dr. Terri Alani. Thank you.